Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Let's Medicine. This is the series of osteology of the lower limb और इस वीडियो में हम हिप बोन के बारे में डिस्कस करेंगे in which we will cover the points regarding the site determination, the anatomical position and the important bony landmarks of this particular bone. The bone which I am holding right now is known as the hip bone. There are basically two hip bones in the human body, one on each side. These two hip bones, they articulate with one another at this point. This is actually the pubis, and they articulate with one another at this point, and the joint that is formed in between them is known as the symphysis pubis. On the posterior aspect, the hip bone over here, it articulates with the sacrum and the coccyx, and these three bones, after the articulation with one another, they give rise to the bony pelvis. हिप बोन इज़ प्रेजेंट इन सच अ वे कि जब हम उसको होल्ड करते हैं या हम उसको एनाटॉमिकल पोजीशन में जब हम उसको देखते हैं तो हमारे पास ये जो आपको एक फोरामेन नज़र आ रहा है, दिस इज़ नोन एज द ऑब्टुरेटर फोरामेन. इट लाइज एंटीरियरली in anatomical position, and this depression over here, this is known as the acetabulum. It lies on the lateral aspect. This is basically the point where the head of the femur articulates and give rise to the hip joint. As you can see over here that this depression that is known as the acetabulum, it has two parts. ये outer part है और ये बीच में आपको एक inner part नज़र आ रहा है. The outer part is covered with the hyaline cartilage and it is known as the lunate surface. Whereas जो inner part होता है that is bare area, it is not covered with any cartilage. Over here the hollow structure, this is known as the obturator foramen, and in the alive people it is covered with obturator membrane. The obturator membrane on the superior aspect is deficient in order to give area to the obturator vessels and nerve to pass through it. नाउ डिस्कसिंग अबाउट द साइड डिटर्मिनेशन. तो जैसा कि मैं आपको बता चुकी हूँ कि जो एसिटाबुलम है वो हमेशा हमारे पास लैटरल एस्पेक्ट पे आता है और जो ऑब्टुरेटर फोरामेन है वो एंटीरियरली लाई करता है. जबकि यहाँ पे अगर आप नोटिस करें ये जो हमारे पास इलियम की जो आउटर सरफेस और जो इनर सरफेस है, तो इनर सरफेस हमेशा स्मूथ होती है, इसका मतलब कि मीडियली लाई करेगी, और आउटर सरफेस जो है वो थोड़ी सी आपको यहाँ पे रफेंड सी नज़र आएगी. तो ये हमेशा हमारे पास लैटरल एस्पेक्ट पे लाई करती है. इसके अलावा हमारे पास एक और तरीका है इन ऑर्डर टू डिटर्मिन द साइड ऑफ द हिप बोन. अगर आप यहाँ पे पोस्टीरियरली नोटिस करें तो हेयर यू कैन सी दैट वी हैव दिस नॉच एंड दैट इज़ अ बिगर नॉच. दिस इज़ नोन एज द ग्रेटर शियाटिक नॉच. This greater sciatic notch जो है that is responsible for easily determining the side of the hip bone. What happens that अगर आप hip bone को इस तरह पकड़ें कि ये जो आपका thumb का एरिया है वो greater sciatic notch में आ जाए इस तरह, तो हमारे पास after holding the bone in your hand, the acetabulum must lie on the lateral aspect. तो इस वक्त मैं इसको अपनी लेफ्ट हैंड में होल्ड कर रही हूँ, तो एसिटाबुलम जो है वो मेरे मीडियली यानी इनवर्ड आ रहा है. तो इसका मतलब है नाउ आई विल ट्राई विद माई राइट हैंड, एंड व्हेन आई होल्ड इट विद माई राइट हैंड, जब मैं यहाँ पे अपना थंब होल्ड करती हूँ, प्लेस करती हूँ, तो आप यहाँ पे नोटिस कर सकते हैं कि जो एसिटाबुलम है वो हमारे पास लेटरल एस्पेक्ट पे आता है. एंड इन दिस वे वी कैन डिटर्मिन द साइड ऑफ द हिप बोन कि आप जिस हैंड में भी इसको होल्ड करेंगे तो इन सच अ वे दैट द एसिटाबुलम लाइज ऑन द लेटरल एस्पेक्ट एंड द ऑब्टुरेटर फोरामेन लाइज ऑन द एंटीरियर एस्पेक्ट. सो उसी साइड का ये हिप बोन होगा. तो दिस इज़ माई राइट हैंड एंड आई एम होल्डिंग इट फ्रॉम द ग्रेटर शियाटिक नॉच such that the acetabulum is lying on the lateral aspect. So this is my right side hip bone. The hip bone has three parts. This broader part is known as the ilium. This part that lies on the anterior aspect is known as the pubis, and this part is known as the ischium. First of all, we will discuss about the ilium. Ilium जो है ये एक broad fan shaped part है, ठीक है, that extends from the outer upper border up till the upper border of the acetabulum, and it is joined by the pubis anteriorly and the ischium posteriorly. The ilium, it has two ends, the upper end and the lower end. It has three borders. This is the anterior border, the posterior border, and one border lies on the internal surface. This is known as the medial border of the ilium. It has three surfaces. Two surfaces lies on the inner aspect, that is the iliac fossa, that is smoother surface, and the sacropelvic surface over here. the sacropelvic surface. And on the outer aspect, it is having a large single a surface that is known as the gluteal surface. Now coming towards the upper end of the ilium is known as the iliac crust. It is a thickened area that forms a ridge-like structure over the upper part of the ilium. The iliac crust can be divided into two parts, the ventral 2/3 part and the dorsal 1/3 part. जो ventral 2/3 part है, it is basically divided into three structures or three portions. The outer lip जो कि lateral aspect पे आता है, the inner lip जो कि inward lie करता है हमारे पास, तो उस वाले area को हम inner lip कहते हैं, और इन दोनों के दरमियान we have the intermediate area. The upper end, it has two spines on both ends. एक जो anteriorly lie करता है, this is known as the anterior superior iliac spine, and posteriorly we have this spinous process that is known as the posterior superior iliac spine. Just behind the anterior superior iliac spine, थोड़ा सा अगर आप इसके पीछे आएँ, almost 5 centimeter behind, तो you can note over here we have a projection, and this is known as the tubercle of the iliac crust. Now discussing about the borders, तो यहाँ पे we can note that this is the anterior border extending from the anterior superior iliac spine and coming down and attaching with the outer surface of the acetabulum. This anterior border is actually having a notch over here just below the anterior superior iliac spine. You can notice over here we have a notch, and this is actually the area where the lateral cutaneous nerve of the thigh can pass. Below it we have another spinous process, and this is known as the anterior inferior iliac spine. Now discussing about the posterior border. So it extends from the posterior superior iliac spine and come downwards. Here it also has a spinous process that is known as the posterior inferior iliac spine. So basically the ilium has 4 spines, 2 superior and 2 inferior. Just below the posterior inferior iliac spine we have a larger notch. This notch is known as the greater sciatic notch. And after that the ilium actually it combines with the ischium. Over here we have the ischial spine, and below it we have the lesser sciatic notch. So the greater sciatic notch is present over here in the iliac part, और जो lesser sciatic notch है वो हमारे पास ischium के साथ related होती है. Over here we can see the gluteal surface of the ilium. The gluteal surface is the largest surface and it lies on the outer aspect of the bone. मतलब कि ये हमारे पास lateral aspect पे lie करता है. Gluteal surface has been divided into 4 parts or 4 portions by means of 3 lines. ये चूँकि synthetic bone है तो we cannot identify those lines properly, but I can tell you the locations. So हमारे पास 3 lines होती हैं from posterior to anterior. These are the posterior gluteal line, the anterior gluteal line and the inferior gluteal line. जो हमारे पास posterior gluteal line है, it actually extends from the posterior inferior iliac spine and it goes upward and it joins the iliac crust. At the mid point of the greater sciatic notch, the anterior gluteal line starts and it extends upward and it ends at the iliac crust. And the third line, that is the inferior gluteal line, it extends just behind the anterior inferior iliac spine, and it extends backward and downward and it attaches with the greater sciatic notch upper border. So these are the 3 lines which divide this whole gluteal surface into 4 portions. Now coming towards the medial aspect of the bone, that is the inner aspect of the bone basically. So I have told you that the inner aspect has 2 surfaces and 1 border. The border is the medial border. It extends from the iliac crust और वो हमारे पास नीचे की तरफ ट्रैवल करता है, और यहाँ पे जो हमारे पास इलियोप्यूबिक एमिनेंस होती है उसके साथ यहाँ पे हमारे पास सुपीरियर ramus of the pubis के साथ अटैच हो जाता है. In the lower portion, this medial border is round and it is smooth and rounded in shape, and this area is known as the arcuate line. We have 2 surfaces over here. One is a larger surface that lies on the anterior aspect, and the other is the posterior surface that is known as the sacropelvic surface. The anterior one is known as the iliac fossa. This iliac fossa is bounded superiorly by the iliac crust, anteriorly by the anterior border, and posteriorly by the medial border. As you can see over here that the anterior inferior iliac spine, and over here we have an eminence that is known as the iliopubic eminence. In between these two structures we have a small notch, and this notch is responsible for the passage of the iliopsoas tendon. This iliac fossa, it is having a nutrient foramen over here, and जिसके through हमारे पास nutrient artery pass करती है, and that is the branch of iliolumbar artery. Now coming towards this surface that is known as the sacropelvic surface. तो जो sacropelvic surface है, it has two parts. One is the sacral part and the other is the pelvic part. जो sacral part है वो basically roughened surface है, and it is divided into two portions, the iliac tuberosity and the articular portion. Iliac tuberosity जो है वो हमारे पास upper end की तरफ lie करती है, and it is a roughened structure. Whereas the articular portion, it is covered with articular cartilage, so it will articulate with the auricular portion of the sacrum and will give rise to sacroiliac joint. Over here we have the pelvic part of the sacropelvic surface. This is smooth surface, and posteriorly it combines with the ischium, posterior part of the ischium. Just in between these two surfaces, you can notice over here that we have a small notch, a small depression. This is known as the preauricular sulcus. Now discussing about this depression that is known as the acetabulum. This is actually responsible for the formation of the hip joint. This is the area where the head of the femur articulates. As I have already told you that it has two surfaces, one is covered with hyaline cartilage, so this is known as the lunate surface, and the other is the bare area that lies at the center. The acetabulum, it is derived from all the three parts of the hip bone, that is the ilium, the ischium and the pubis. So basically the acetabulum has been divided into 5 parts. The posterior 2/5 part of the acetabulum is formed by the ilium. The anterior 1/5 part is formed by the pubis, and the lateral 2/5 parts are formed by the ischium. In the early life of the human being, these three bones, they articulate over here. These three bones, they actually articulate here in a Y-shaped cartilage, and that cartilage, it then as the age advances, it ossifies. So this was the part 1 of the hip bone. Now we will discuss the remaining parts in the next upcoming video. Thank you for watching.